Welcome, everyone. Thank you for joining us for today's CITI program webinar. Today's topic is infection control, prevention, and pandemics. What have we learned? What do we need to learn? And will be presented by Scott Roberts from Yale University. Scott is an assistant professor in infectious diseases at the Yale School of Medicine. He also serves as the associate medical director for infection prevention at Yale New Haven Hospital, where he works to identify and reduce healthcare-associated infections in both patients and healthcare personnel. Scott also continues to perform clinical care, collaborate in clinical research projects, and teach to all levels of medical trainees.
Today, I want to highlight the core concepts of infection prevention in healthcare settings. I will also highlight the variability in pathogen transmission and how this impacts how we handle pathogens when we do encounter them in the healthcare setting. And then I will close with recognizing prevention tools and techniques to really better prepare for future pandemic threats in healthcare, with a focus on some lessons that I personally learned over the past few years in my role. I think we can all agree that hand washing or hand hygiene is a critically important tool to prevent infection, not just in healthcare settings, but in non-healthcare settings as well. In spite of this, we have a lot of work to do. This study I found particularly striking. These authors looked at almost 300 patients who were transplant recipients at multi-organ acute care teaching hospital and looked at how well are patients washing their hands. And I'll note that these are high-risk patients who are organ recipients. We are not doing very well. Patients wash their hands in this study about 30% of the time after going to the bathroom, 40% of the time after meal times, 3% of times when visiting the cafeteria, 3% of time on room entry, and then about 7% of the time on room exit.
I invite you to review our content offerings regularly, as we are continually adding new courses and webinars in various areas of research, ethics, compliance, safety, and professional development throughout the year.